Good evening. Welcome, Shukla Bose. As you know, this is a series which we are doing on behalf of the Heartcrafted Foundation. We call it COVID Cares, which it captures some of the stories during the COVID and the lockdown, where people have done extraordinary things, and most of the times, ordinary people have done extraordinary things to help people who are in need. Now, most of us who are like us struggle with issues like where to get our supplies, healthcare, whether the maid is coming, driver is coming. But there's a large segment of the population who struggle with much baser issues like income, like job loss, like next meal, like where to go if you are sick. And there are a bunch of people who had been working with these people for a long time, woke up to the situation and took steps so that their pain was reduced. We are talking to one of them today, Shukla Bose. I will take a moment to introduce Shukla. So Shukla Bose is the founder and CEO of the Parikrama Humanity Foundation, a non-profit organization that runs English medium schools for the underprivileged children in Bangalore, India. Shukla's career began as a teacher in a convent school in Calcutta, and she later moved on to work at an army school in Bhutan. She then worked with the Oberoi Group and afterwards worked as the managing director of RCI India. In 2000, she accepted an offer to run a multinational NGO for children and started their Indian operations. During this time, she also volunteered for Mother Teresa at Missionaries of Charity and had been involved with them for over 7 years. Shukla spent 26 years in the hospitality business, and then at some point of time in 2003, she decided to give up her position of CEO and started Parikrama Foundation. Shukla Bose studied at Loreto College, Calcutta, and did her master's in comparative literature from Jadavpur University. Shukla, welcome to the show, if I may say that.
Thank you, Dipankar.
So Shukla, I am personally a great fan of you and your work which you are doing in Parikrama Foundation, and almost everybody knows the work which you are doing for the underprivileged children, the way you transform the lives of so many of them. But today, I specifically wanted to talk to you about the COVID and the lockdown and the challenges which suddenly befall most of us, but especially for the people who you work with, people who probably don't have a roof on their head. They obviously always struggle for money. They are socially underprivileged at the margin. And COVID, where, everything was closed down, no employment, no access, probably for many days, both the government and the civic society was completely unaware about their challenges. Let me be very candid, including myself. We did not even understand that there is a segment beyond us who are suffering, but you, I'm sure, understood maybe even before the lockdown happened that this is a situation which is coming up now. So I will ask you, when you saw this, what went through your mind? What did you think you should do, and how did you proceed to help them?
Okay. Dipankar, first, thanks for inviting me to be with you here today. It's always a pleasure to talk to like-minded people. Thanks for giving me the opportunity. You know, I've got to really begin a little before lockdown. It's very, very obvious to most of us that this inequity that exists in our society is grossly unfair, right? And that is what has propelled me to quit corporate life, which was a fairly high-flying, luxurious corporate life, and start doing this kind of work at the grassroots level, which means a absolute metamorphosis, a total sea change approach to living. Now, that because I not having worked in the corporate world, my perspective of looking at the the underprivileged lot, the marginalized, was a little different. And having worked and volunteered with Mother Teresa, it kind of gave me the spirit and the courage not to get daunted and dive in and do this. While working with children of the underprivileged, we don't use the word underprivileged in parikrama. We call them underserved, because we take on the responsibility as an element of society of not having served them well. They are not
Absolutely.
really underprivileged, they have
Correct.
not been served well by us. And having worked with these people, I was very conscious and aware how vulnerable they are, how fragile their lives are. Because even when things were okay and times were good, um, we would have at least about 11, 12 deaths in the family members of our children, the fathers, because they're so susceptible to disease, they're so undernourished, they would just succumb to any kind of ailment. So when we began hearing about what was happening in Italy, what was happening all across the world, we knew that very soon it would be entering our country, and we knew, and I was very aware that if it hit India, it would be like the casualties were going to be even more, only because the way people live in the slums, they live in such congested communities, such unsanitary conditions, such undernourishment. So obviously we knew that we had to get prepared for this. So when the lockdown happened, the first lockdown happened, uh, my parents, that means my children's parents, lost their jobs. They are all daily wage laborers. They lost their jobs. There was no earning coming in, and while our children were confined to their homes, I would be getting messages from them saying that they have not eaten. And that was something, horrible to have to confront, that there were people that we were working with are actually starving. So the first thing that we had to do was to create a system by which initially we distributed cooked food to our families. Our parents, the children were left behind home. The mothers or the fathers would come and collect cooked food from us. We organized cooked food from other agencies who either donated to us or provided us in a subsidized manner. And so we, for at least about 4 or 5 weeks, we provided cooked food. Um, then we realized that, this is going to be here long term. So we didn't have the capacity of such a large kitchen or providing cooked food all the time. And secondly, we also found that cooked food had very uh, low shelf life. So if we provided our families with bisibele bhat, khichdi, for instance, or sambar rice, or chitrana, the kind of food that our families are used to, they wouldn't last very long. And so the next step was, let's provide them with rations. So we started providing rations, about 5 kilos of rice, 3 kilos of dal, oil, half a liter of oil, sugar, salt, spices, 1 kilo of atta. We sort of proportioned it to feed about a family of 6 or 7, maximum 7, for about a week.
Mhm.
Then we started also giving them vegetables,
Mhm.
because the farmers also needed to sell their
Absolutely.
produce, right?
Right.
So
Right.
we would get them subsidized, buy them in a subsidized manner, and started providing vegetables. But vegetables too were getting bad quickly. So we said, okay, we will only provide dry rations.
Mhm. Mhm.
Um, we first began by providing dry rations to about 1,500 families, uh, uh, coming from 87 slum communities. For us, it was one great advantage was we could follow all the social distancing, all the hand sanitizing, masks, and we actually got our families to wear masks long before masks were made mandatory,
Mhm.
because we knew that that was one real safeguard for
Mhm.
them,
Mhm.
and because they would come to the school. So in
Mhm.
the school, we were able to
Mhm.
manage and control the distribution in a fairly organized manner, to the point that it was picked up. The media saw it. The distances, we would create boxes, and the distances that we were able to maintain, and then the government inquired about how we were doing it, and tried to follow that in other areas as well. For us, we were familiar with the families. Our parents knew us. They trusted us. They knew that we were very disciplined. So there was no chaos at all in that,
Mhm.
and we were able to manage. So I would go, and I would go myself,
Mhm.
because how can you put
Mhm.
your team at risk if you are
Mhm.
not in the
Not
front?
there.
So
Yeah.
I
Mhm.
was there all. I was the oldest member. I was myself at risk, but I just had to be there. And so we started distributing food every week. I would go to all my four schools and start the distribution. We got to hear stories of how many days they had not been eating, how the public distribution system of ration distribution through ration card was not working in certain areas. We got to really hear the desperate conditions of these families. uh, we were conflicted when we heard that we were giving them the rations, but they didn't have the fuel or the gas to
Mhm.
cook.
Cook.
So so every obstacle we met helped us to evolve another system.
Mhm.
To the 1,500, once the locality got to know that Parikrama was distributing food,
Mhm.
uh, there were more and more requests
Yes,
coming in. Okay, so Dipankar, I had no idea, although I've been working now for nearly 19 years with slum dwellers. I had no idea that there was such a dense refugee settlement in Bangalore, refugees from Myanmar, refugees from Bangladesh. They're all pockets, and they're being, they're identified, they're being supported by UNESCO, and that's how the information came to us, saying that we are not able to reach out to them because everybody was not being able to be mobile, right? They were,
Mm-hmm.
because of the lockdown, they were all confined to that. But we had taken special permission for our vehicles, and so the police, with police escort in some places as well. So there we were not in control. When we went into these dense refugee settlements, there was mob and there was chaos, because nobody had reached out to these people for weeks. And it
Mm-hmm.
was absolutely, oh, it was tormenting to see such despair.
Mm-hmm.
So they would climb onto the vehicle,
Mm-hmm.
trying to grab. We didn't face that with our parents, because
Mm-hmm.
they knew us. They were
They had
confident
some
that
assurance,
every
yeah.
single family, yeah.
Yeah.
So that's, I mean, that's been a great learning, for
Mm-hmm.
me, Dipankar. I had no idea that there was such a dense refugee settlement. I had no idea what kind of living conditions they were in. I mean, it was, I came away from these refugee settlements saying, the parikrama families in these dense slums were so privileged,
Mm-hmm.
because they, they were privileged as compared to these refugee settlements. So this has been a very interesting, important, and meaningful learning experience for me.
What you said is for most Indians, I think the biggest shocker was that, just behind our house and lane, there are poor people. Because, I will not say most Indians, but most people like us, right? We drive on
Yeah.
this airport road and see these swanky big houses and malls and think that this is life, right? And at best, we have somebody coming and working. So a lot of people are totally surprised and very insensitive to start with about migrants. But I am very, uh, I'm actually a little sad to hear that even from the perspective of somebody like you, who is so exposed to, poverty and people who are in the margin. I mean, even you could, for you also, it was a surprise that so it means how many more people are actually so bad in condition,
Yeah.
can't even
Yeah.
imagine, right? So
Yeah.
this is, we'll come back to that. I hope that, this awareness, which at various level, for you it's different, for me it's different, somebody else is different, but probably, as one of the discussions, somebody was saying that it opened up the, the India from inside out, right? We are just looking at a surface and thinking, but it suddenly the
Absolutely.
entrails came out and you felt, oh, it's so ugly. Now, so so just to ask you now, when your numbers became so much more, when you are reaching these people who are refugees and other poor who probably you are not connected. So did you scale up the operations or how did you manage?
Oh,
Because
yes, of course. Of course, we
okay,
had
okay.
to. We
Hmm.
had to, I mean, it was a proper distribution, system, and operating procedures were established where um, uh, we had to obviously, earlier in the beginning, you know you see, in parikrama, uh, for you know about parikrama. For those that don't, for the audience, um, we in parikrama, we really believe in the holistic intervention program. So it's not just a school, it's also a nutrition program, it's also a healthcare program, it's also family care program. Because then only when a child's well-being is taken care of, then only learning happens. Learning is not just giving them a textbook and telling them how to read or write or do numbers. I mean, that's what most people think true education is. But actually it is, the child should feel well, and wholesome, and then only learning happens. So we provided, for 17, 18 years, we've been giving 3 meals a day to our children: breakfast, lunch, and evening protein mix and snacks. More than 88% of the calories that they require were given in the school, much more than the midday meal that we flaunt around, So because of the lockdown, the money that we had saved by not giving the breakfast lunch was being used to procure and distribute rations.
Mhm.
But after some time, because the numbers were increasing,
Mhm.
obviously we ran out of the
Mhm.
allocated money, right? And so we had to raise funds. We
Mhm.
appealed to people. It was costing us about 720 rupees per package.
Mhm.
Okay, because
Family of
obviously
seven for
we
7 days.
oh yeah, 720 rupees for rice, dal,
Mhm.
vegetables, oil, all that put together, which would last a family for a week. So we had to raise funds, but I have to say that there have been many corporations and individuals that came forward when they saw pictures of our distribution, when they heard stories of how in certain localities, while the MLA had not even walked through those little communities, the first meal they were getting after at least 7-8 days was what we were giving them. When we started telling people this and the desperate condition, then people started contributing. Many very nice individuals sent sacks of rice. Some gave in kind, some gave in cash, and we were able to then get the confidence that we can expand. We didn't want to start something and then give up midway. So altogether, we're still distributing rations, by the way. Okay, we're
Mhm.
still distributing. In some localities, we've kind of reduced the frequency. Like instead of once a week, we're doing it once in 10 days. But we
Mhm.
have to, because the lockdown may be over, but they haven't
Mhm.
got jobs as yet.
Right,
The
right, right.
construction industry hasn't picked up. The masons and the plumbers are not getting, the auto rickshaw
Mhm.
drivers, they have lost their
Absolutely.
business. So we've got to keep them going
Right.
till they are able to get
Right.
a satisfying, fully paid job. So what happened was, it was interesting for us because we realized, okay, once we are able to keep the families fed to a certain extent, we have to go to the next level, because after all, we are essentially an educational institution, right? We didn't want our children to stay out of school. uh, we were being forced to, they were being forced to. Dipankar, for children that come from the slums, it's much more than poverty that afflicts them. It is dysfunctionality. If these
For the
kids
society,
are
yeah.
moving around in the slums, they will be easy prey to antisocial elements.
Mhm.
Uh, Drug peddling is very high. So uh, petty thefts, pickpocketing, they have, the incidence of this has increased considerably, because what do little children do? They are being made to do all this. So
Mhm.
we had to keep our children away from this, and
Mhm.
therefore we had to, while we couldn't bring them to school, we had to begin the learning process.
Mhm.
Now, our children don't have computers, our children don't have internet. So, how do
Mhm.
we do? So, we did an appeal to our friends. You must have received my
Yeah,
mails
yeah.
as well, right?
Cell phone, yeah.
Um, Give us your spare
Mhm.
smartphone, or, if you have an unused smartphone. And people responded. They dunzoed it to us, and we were able to revamp them, program the smartphones, and we distributed nearly about 450, 500 smartphones all across these 87 slums where our children live. We identified kids of the same age group who could share a phone. So we created little corners in the households where our children come from. Some we identified households where there's little extra space, it's not on the kitchen itself because there'll be less noise. So, and then we've found parents as champions who took on the responsibility to supervise the children. And we called it the Parikrama Reach V School, reaching virtually school, and little corners where children would sit, and we have begun online classes, and our online classes have been going on for 4.5 months. You may have heard that there was a lot of debate about online classes. Is it good for children? And we said we can't wait for any verdict coming out from the government, because the schools are not operating, the children have gone away to their native places, the schools are totally shut down. We cannot afford to do that. It is, Dipankar, it's estimated about 10 million children in India will drop out from school of post-COVID. Because first, and a large percentage of them would be girls, because they've been put to housework while the mother is searching for a job and taking care of the younger siblings because schools are closed. They are not likely to get back to school, but it is not going to happen with the Parikrama schools, because our children have been attending school all through for 4.5 days. So here it is. First was food. We had to take care of the food to make sure our children and their families were fed. Second, we had to create a learning process. Our online classes are doing fantastically well, 85%. I mean, normally in our normal situation, our attendance is about 96%, but online classes has been about 85%, which is much more than we expected. We have challenges of recharging and data and all that, but we've managed to overcome that. Then the next stage, what we have also started, helpline. The number of suicidal cases have increased tremendously. Look, we complain, right? You and I have complained about, getting stuck at home and working from home and, not being able to go out. Yeah, we are complaining about that. But I always tell myself that, I have at least a house where I can go to the next room. That's at least variety. I can look out of the window. I can, sit in the balcony. I have a terrace. Most of us have that. You don't need to be affluent to have that. But look at these kids, where the houses that they come from. 100 square foot places. Like now that it's raining, the last couple of days there's been heavy rain. Our children's houses have been flooded with sewage, because just opposite, instead of a garden or a balcony, they have a huge drain that carries sewage. So look at the disparity. When we crib about a few things, we must be aware and conscious of what's happening. I mean, we need to be so thankful for all that we have.
Absolutely. In fact, that is one thing, in many ways, maybe we can feel, lot of people want to ignore it. A lot of people feel for it, but they feel helpless. But I am hoping that, there will be a change, because right now it has affected us in multiple ways, right? For example, I was talking to one friend of mine who runs a small industry. He says that, so a lot of industries on the day one itself told their contract workers that you're dismissed. So he said that, I can't imagine that you can't even pay one day's salary, but, people just took advantage of the situation. Yeah. And then when the lockdown, so he retained his people, and he said that I could start in the month of May I could start, on 10th May I could start my production, and I did 90% on that month itself. And next month I did 130%, 150%. The people who let their employees to be dismissed are still struggling because the employees are not coming
Yeah.
back, right? So
Yeah.
people in the social side as well economic side also in a very
Yeah.
distorted way, and things will hopefully change
Yeah.
in some of us. So I was, while you were doing this food and all, I'm sure you faced some other challenges of people saying, I'm sick, I want to go to hospital, maybe somebody is
Yeah.
expecting. So
Yeah.
did those requests also
So,
must have
so as yeah, as I was saying, first was the food, then was learning. Second was what we created a Parikrama listening post. Okay, we
been.
created a
Hmm.
helpline for our children as well as their mothers and fathers to get in touch with us if they were
Hmm.
distressed, because we didn't want them to commit suicide, but
Hmm.
we wanted to intervene quickly. So there was the first physical, intellectual, and then the mental and the emotional health of the children. We also, one of the this real sad thing, Dipankar, is we are so behind as far as public health system is concerned, right? I mean, if COVID-19 hasn't taught us and made us aware of how dismal a public health system is, how dismal a public distribution system is, how ignorant the government, and and this is not a political statement, any government for generations,
And
okay,
we are part of it anyway.
government
Yeah.
administration are not aware. There are more than 42 crores of migrant laborers in our country. I mean, if COVID-19 hasn't opened our eyes to that, nothing will. Okay. So, we had situations where our um, families were being evicted from their landlord by their landlords because they hadn't paid rent. Okay, they had stopped earning and they hadn't paid rent. Then we've heard challenges of um, our parents not getting access to healthcare because they're very behind the queue. Okay, so
Mm. Yeah, the
um,
testing and all that.
the the discrimination and the disparity in all levels is so stark. But I have to say, a big point of hope is uh, we have seen, and during this time, like-minded people, fraternities of various kind, as well as NGOs collaborating together to work. So we've really learned that we don't have to depend on the government to take care of many of the things. Okay, we can all, in a civic society, if we all get together, I'm sure we can make a huge amount of difference. And that's what we've seen. You know, the government has never been very proactive as far as depending on NGOs is concerned in the past. There have been lots of, I mean, NGOs have been looked at with a certain element of mistrust,
Yes.
suspicion, but this is the first time where the government actually reached out to the NGOs seeking help, because they realized that they didn't have that penetration into the grassroots
Absolutely.
that NGOs have. I
Yeah.
mean, I have been talking to bureaucrats and telling them about pockets of, settlements which they were not aware of. So because we are all over the place, we have to be aware, we have to do the right analysis to be able to take strategic steps forward. We do not wait for officers to come and report to us. We do it ourselves. That's the difference. We walk the streets ourselves, the slums ourselves, because that's the only way you will be able to get the true picture. Those guys who make the policies, Dipankar, they don't always know the true picture. They're very astute, and they're great policy makers, but the they're very poor in identifying how implementation will happen.
Absolutely. I agree. I absolutely agree. And, as you said, there are a lot of people who may be, good intentions, but they are not real because of their lack of exposure. And this other point, absolutely, I think this is a great way of people to come together. I think a lot of good people have been, in a way, Samudra Manthan has brought up the goodness of people, because, mostly we have been only seeing the negative side for quite a few, for a long time. Let us put it, we have been quite
Yeah.
dejected. The right thinking individuals are quite upset. But yes, at the same time, we have to also push the government, because ultimately it has the resource and it has the reach.
Yeah.
So
Yeah.
we'll conclude, but I just want to ask you, do you would you like to share a story or two? You are in a situation where every day is a miracle. I remember you said your goal is to make kids talk in TED, TED speaker, but every other day you post in LinkedIn, or people coming back who have reached such, and so you are seeing miracles every day. But nevertheless, even with that experience, did you recollect any event or anything which sort of touched you very positively, maybe in terms of humanity, in terms of resilience, in terms of courage, in terms of during this time? I mean, need not
Yeah,
need,
I mean,
but anything you like to say?
there are lots of
Particularly. Mm,
stories. For instance, this, we had to wear the hazmat suits to do the distribution, right?
right, right.
Because obviously uh, I couldn't take the risk of any of my teachers falling ill. But I can't tell you how heartwarming it was to see in every school at least 10, 12 of my alumni coming forward and pitching in and actually educating their parents and their community when we were doing food distribution
Mm,
on how to manage sanitary conditions, how to manage social distancing,
distance,
how to wear the mask, even how to wear the mask. It was
right.
my students who are now
Mhm,
software engineers and all. They were all not working, and they were
mm,
working from home, or nurses, and I have three during this COVID-19. I have two of my students who are actually uh, helping in the virology department of actually processing and identifying and doing research with virus. They're from the slums.
mm,
Okay, I
mm,
have in reputed hospitals nurses that are actually, they were sending me their photographs with
mhm,
their PPE
PPE, yeah.
suits. Yeah.
Mhm,
Um, so we had all pitched in,
mhm,
but the whole idea was, I thought the young people that came out from Parikrama was so much ahead in their thinking than the spoilt rich brats that we have in privileged homes. Why? Because they've gone through the grind, right? They understand what it means of ensuring that their parents, their families, and their community would have to stay safe. I have used my alumni to go around as supervisors to make sure that all the children were using their phones and doing online classes and not getting distracted doing anything else. It was my alumni that pitched in. So I feel youth is a great force if you correct, if you know, guide them well. And for me it was very fulfilling, because it's like we've all our hard work has created a new generation of evolved contributing members of society. That's what good schools should be doing, right? So yeah, that's one of the things that I'm very happy about.
Good. It is so happy to hear that, these kids who have come from a section of society and then successful, but they have not cut their, the connect. Many times, people try to forget, right? And they get into the new good life and say, I don't belong to where I came from. The forget the roots. And I fully agree. And I have seen, it is my view also, that the next generation is, with all their whatever you said, brat and all, but still they are better than the us, for sure, and the generation after us. I mean, there are so many generations have gone through. I think the people who have born after 1990, who are early teen, late teens and onwards, absolutely they are the hope. And you are possibly in a very really sweet spot of working with them, and in some way you are extremely lucky also to be connected
Yeah,
with them and building the future.
I'm a proud mother.
So Shukla, thank you so much. Thanks for your time. It's exciting to hear all the time from you. And good to hear that you reached out to so many people, and some of these I'm sure is absolutely a revelation. I mean, I had no idea whatsoever that there are pockets of refugees. I thought there, there are obviously very poor people, but refugees being supported by UN, or people have not got food for a week. I mean, probably, I don't know, they were really literally starving,
Yeah,
and still they're maintaining their dignity. They have not come on the road,
yeah,
or start looting others and
yeah,
all. We have to really appreciate
yeah,
how good they are
yeah,
at their heart, right? If they
yeah,
go berserk,
yeah,
we
yeah,
will all be threatened, right? I mean, this is
yeah.
just the goodness of saving us. We have to also accept. So thank you so much. Thanks for your time. And I will discontinue the recording, but just hold on. My wife will just want to show her face to you. We planned so many
Sure.
times to come and meet you, but never happened. So just give me a moment.